Okay, so today we will be talking about narcissistic personality disorder. Today we will go over what narcissistic personality disorder is, narcissistic personality disorder in children, neurological differences in people with narcissistic personality disorder, and treatment options. So first, what is narcissistic personality disorder? To understand what narcissistic personality disorder, or NDP for short, you have to understand what narcissism is. So narcissism is characterized by a grandiose sense of self-importance, a lack of empathy for others, a need for excessive admiration, and the belief that one is unique and deserving of special treatment. NDP includes pathological and non-pathological grandiosity, expressions comprising envy, exploitation, irritability, cunning, lack of guilt, and sadism. The DSM-5 primarily uses the basis of impaired function in 2 of 4 categories. Category 1 is identity, empathy, and intimacy, and self-direction. Category 2 is grandiosity and attention-seeking. Next, we will talk about narcissistic personality disorder in children. Diagnosing and treating personality disorders in children and adolescents is controversial, as many believe that the personalities are not completely formed yet. Yet some believe that in certain youths, when there's a pattern of behavior, can be very similar to those adults with NDP. The DSM does not include children in NDP, though there are many parallels in symptoms and treatment between adults and children. Though diagnosis of NDP is not common in childhood, adverse childhood experiences, or ACEs, may affect the development of narcissistic personality disorder. In a study of Chinese adults with NDP, childhood neglect, physical and emotional, was most commonly reported amongst the adults with narcissistic personality disorder. Now is the neurological differences. This study, there were 3 microstructures in the brain that had decreased white matter in the study of young males with NDP. The connection pathway, so there are 2 parts in that: the inferior longitudinal fasciculus, which involves decision-making and behavior of visual guidance, and the superior longitudinal fasciculus, which affects attention, memory, emotion, and language. The association pathway, which affects the neurological connection between self-related processing and pleasure subsystem, which can affect the positive self-view that people with narcissistic personality disorder typically have, as well as the projection or thalamic pathway, which affects emotional monitoring and facial expressions. The treatment for NDP is quite varied, but one study says it should focus on increasing self-reflection and reducing intellectualization, reducing the impact of maladaptive schemes, and forming healthier and more flexible ideas of the self and others, supporting agency, counteracting maladaptive coping, and promoting healthier ways of dealing with suffering. And one form of talk therapy developed by Bach to treat NDP begins with the process of showing the more accessible side of their narcissistic personality disorder until they feel comfortable with the analyst, to show a more hidden and harder to reach side of their NDP. And once both sides are their grandiose and their vulnerable side are shown, they can feel more like a whole person and make more process in therapy that way. In this article, it says, while the framework may seem much too oversimplified and skeletal, it has been remarkably grounding and orienting for us as we have worked with narcissistic patients. And that is all. Thank you.